Good morning. I'm here from Florida. My name is Dr. Panita Sriarun, and I am an Associate Professor of Internal Medicine and Pediatrics at the University of South Florida. It is my pleasure today to be here with you all for the USF Global Health Conversation Series. We have a special guest today from far away, Dr. Suttipong Wacharasindhu. He was my faculty when I was med student, so it is my pleasure to be here with him. Before we get started, I have a few housekeeping rules. So during the presentation, the audience will be muted. And also we have the Q&A box. So if you have any questions or discussions you would like to add at the end of the discussion, please feel free to type them in. Also, the meeting today will be recorded and eventually will be posted on YouTube and also from the USF Health website. It is my pleasure to introduce Dr. Suttipong Wacharasindhu. He is the Dean of the Faculty of Medicine at Chulalongkorn University in Bangkok, Thailand, and also the Director of King Chulalongkorn Memorial Hospital. King Chulalongkorn Memorial Hospital is affiliated with Thai Red Cross Society. It is a 1,500-bed hospital and also provided up to 1.5 million outpatient visits per year. Dr. Suttipong has been the dean since 2015, and since then he has led multiple missions throughout several outbursts of the viruses. But today it is different because in Thailand, which is a size of a little bit less than the state of Texas, the count of the coronavirus confirmed cases are still around 28,000, with deaths less than 100 confirmed deaths from coronavirus. So it is interesting to hear why Thailand can control the cases so well. Is it about a lockdown? Is it about the social distancing or mask wearing? So Dr. Suttipong today will go over with us about a strategy that Thai Ministry, the Public Health Ministry has conducted, and also how he leads the hospital, which is a medical school, to provide care and to keep the staff very safe. So Dr. Suttipong, without further ado, it is yours.
Hi. Right, thank you very much, Dr. Panita, for your introduction. So I share my screen now. Right, everyone see my screen, right? So first of all, I would like to thank USF to invite me to share my experience regarding the COVID-19 and healthcare system in Thailand, and it's a perspective from our medical school. So I just show you where our country is located. Thailand is here. It's in roughly around the middle of Asian country, and on the western side is close to Myanmar. And for the eastern side, we close to Laos and Cambodia, and Malaysia is located on the southern part of Thailand. And we have about 70 million population in our country, and Bangkok is around here, is nearly in the middle of Thailand. If you look at the data of the COVID-19 test, the RT-PCR have been done here. So far from the outbreak, from the beginning of the pandemic, you can see that we have about nearly 3 million COVID-19 RT-PCR tests. However, the number of our COVID-19 positive COVID-19 tests is around 28,000 cases, and we have less than 100 deaths from this pandemic. If you look at the outbreak in Thailand, we have two main outbreaks. The first outbreak is happened just about January, the beginning of January, and then the first case of COVID-19 came into our country around the first or second week of January. And then the outbreak is seen to be increasing. The percent of the people going to be increased during the February and March. And we reached the peak around April. And then the outbreak get better. And the case is quite rarely seen during April or May 2020 until the second outbreak. It happened the end of December, we have the second wave or second outbreak is due to the illegal immigrant from Myanmar. And then at this time, the outbreak of the COVID-19 is seen to be up and down like this until present. If you look at the number of the COVID-19 tests per 1,000 population, uh, nowadays we test a bit more than 40 tests per 1,000 people in Thailand. Since the outbreak of COVID-19 in January 2020, the government set up the center which we call CCSA, or the Center for COVID-19 Situation Administration, or in Thai we call Sabakor, led by Prime Minister. And there are many sections involved in this center, including the Ministry of Public Health, Ministry of Interior, and Ministry of Defense, because they need to do the country security and announce some regulation. Ministry of Education, Ministry of Foreign Affairs, and University Hospital Networking, or we call UHOSTES. And our institution, our hospital is one of the members of UHOSTES. This center, they're going to set up the policy to fight with the COVID-19, and they have to control the drug and supply to make sure that every healthcare center in Thailand have enough medicine and supply. We need to control the healthcare system management in Thailand, and we need to be careful about the foreigner coming to our country. If you look at the outbreak, as I mentioned previously, the first case of COVID-19 come into Thailand, and this was reported in around the first week of January, and the CCSA was set up around the mid of January. We have done a lot of screening checkpoint in airport, in border. We screen in the risk person and also the patient with the ARI. For the community, we also have to do the surveillance, and we have the group of people to educate the people all around the country. The government set up the policy as a universal precaution, including the social distancing, wearing the mask, and hand washing. Until the 26th of March, the government announced the emergency situation, and at the time, our country had to do the lockdown policy. I would say that it's not 100 lockdown policy, just about semi-lockdown. That means we didn't allow people, get out from the home between 9 p.m. and 5 a.m. And some of the department stores, some of the sport complex has been closed down to avoid the close contact between people. And then we can control the first outbreak by end of April and May. And the second outbreak, as I mentioned, we have Myanmar on the western side of our country. So if you remember at that time, there was a big outbreak in Myanmar, and a lot of people from Myanmar came into our country, and they worked in the factory nearby the border, especially in the province that we call Samut Sakhon. And that's why we have the second outbreak or the second wave. At this time, the government, they have to keep balance between healthcare management and also the economics of Thailand. That's why at this time, we didn't do the lockdown policy, but we have to do the zoning area. We divided the area into red zone, orange zone, yellow zone, and green zone, depending on the number of positive cases. And if we have the red zone area, we need to seal the area, such as we seal the factory and we do the active case fighting. However, the school and university need to be closed, and we encourage people to work from home. The universal precaution is still using, including the wearing the mask and alcohol gel and physical distancing. So if you look at the key success factor to fight with COVID-19 in our country, I would say that the first thing is about the people, the multitasking village health volunteer, or we call OSMO in Thai. We have more than 1 million health volunteers working in all villages around Thailand, and they know the community very well. One of them have to take care up to about 10 families, and they visit the family, I would say that every day, and they keep them updated on about the pandemic. And they also check the family member, especially the elderly. So if anyone have, leave the community, or anyone seem to be the stranger coming into the community, they would know that, and they will report to the officer at the district or province level. The second key factor is about the deploying of the universal precaution, including the wearing of masks, personal hygiene, alcohol hand rub, and physical distancing. And semi-lockdown policy and curfew is another one factor that we could control the first outbreak, decrease the movement. And we have the quarantine policy. That means everyone who get into our country, they need to do the state quarantine for about 14 days. It's a compulsory. If you look at the data survey by the Ministry of Public Health for the Thai people wearing the mask, it's vary between 70 to 95%. And we have the survey about the using mask and using the alcohol gel in the public transport. You would say that the Thai people wearing the mask about 89% during their travel at the public transport. And they use the alcohol hand gel to clean themselves. They might carry by their own, or they use the alcohol supplied by the public transport station. This is another slide to show you the behavior survey of the Thai people from May 2020 until March this year. You probably see that the green line here represents the percentage of Thai people wearing the mask. The purple line here represents the hot meal eating, and the blue line here represents the hand washing. You see that the high percentage of people wearing the mask, washing the hands, and then eating the hot meal during the very peak of the outbreak here. And when the outbreak getting better, the percentage of people wearing the mask is seen to be declined. And then when we have the second wave or second outbreak, the percentage of people wearing the mask go up again, up to present in March. This is quite an update survey. We found that at present, 85% of Thai people still wearing the mask, and 81% of them try to eat the hot meal, and 78% of them still using the hand washing, alcohol hand washing, or alcohol hand gel. So come back to see in our institution at King Chulalongkorn Memorial Hospital. Since the government announced the first case of COVID-19 on the 4th of January, 2 days after that, our institution established the committee to fight with the COVID-19. And we started screening of people coming into our main building or outpatient department to need to be screened. And then by the end of February, we have the hospital precaution in every department. By end of February, we set up the ward, the COVID ward at the EID center. Actually, the EID center is a center represent from the Emerging Infectious Disease Center. It was established in 2015. At the time, our committee foreseen that they're going to have some emerging disease in the future. We have learned from our country nearby, such as China, that they have some SARS and MERS. That's why we think that we're going to face with the new emerging or re-emerging diseases. That's why we renovate the old building to become the EID center. And then we have to use this center at this episode. We have the first of positive COVID-19 case at our institute around the first week of March. And since then, we have to expand our service. We expand the beds for the COVID-19 patient. We have what we call hospital. It's a combination of hospital and hotel. That means we use the hotel about 1 kilometer from our institution to become the isolation unit. It's similar to the step down area. That means the people who get better from the COVID-19 and day before we discharge them home, we just put them here for a week to make sure that they not going to transmit the disease when we discharge them back to the communities. And we also have the experiences with the COVID-19 in the delivery room and also COVID-19 who the case that they need the surgery with the appendicitis. We also developed the telemedicine screening clinic and also chatbot that I'll let you know later. This photo show you our EID center. EID center, as I mentioned, we established in 2015. It consists of two parts. The first part is the clinical and training part. We renovate the old building, low-rise building to become our clinical center here. And we have the research and innovation lab in another building, and we work closely between clinical and research center here. If you look at the photo here, this is our institution. This is the main building for ordinary healthcare services. This is the outpatient department. This is the pediatric department here, and this is the inpatient department. We have the low-rise building here, and it's located, separate from the ordinary healthcare services. This is the EID center. So we have to do zoning to divide the COVID area from non-COVID area because the ordinary healthcare services need to be sustained, and we need to train health personnel to work in this EID center. If you look at this square here, the red square here represent the EID center or COVID-19 area. If you have any new patient, they probably want to know whether they have the COVID-19 or not. They probably just telephone, or they just come to use our screen telehealth, or they use a chatbot. The chatbot look like the application that you can answer your question and you can score yourself. If you have the high score and you have the high risk to develop the COVID-19, you just get into our EID center here. And we have the check or screening point at the outpatient department and emergency department. When you have suspected to have the COVID-19, you just came to this EID center. You're going to have the swab test done, the RT-PCR done, and chest X-ray done as well in this center. And if you are confirmed having the COVID-19, you're going to be admitted here. We have the cohort ward. We have the intensive care unit in this EID center. And when you get better from the COVID-19, as I mentioned before, we discharge you home. You're going to stop at the hospital about 1 kilometer from our institution, and you stay there for a week or 10 days until we make sure that you're not going to transmit the disease when you go back to your communities, and then we discharge them home. After we discharge the patient home, we're going to follow them for a month by using the home healthcare team, or maybe if they live far away, we just call and ask them whether they are okay or not. We also integrate the education and research in this EID center. This is a chatbot that I mentioned. This chatbot is taken care by the 6th-year medical students. You just upload this QR code and you can get the questionnaire. You can screen yourself, and if you have the high score, you will allow to see the doctor or health personnel at the EID center. This photo show you the EID center, how it looks like. We have the reception area here. we have the telemedicine to get the consultation with the doctor at the outpatient department. And we also have the swab clinic. We also have the cohort ward and also intensive care here. And this is a nurse station here and intensive care here. We also have X-ray and CT scan inconclusive in this building. As I mentioned, we have the hospital to be the isolation unit. Look like the step down area here. This is a hospital about 1 kilometer from our hospital. Actually, it's the hotel, and we transform this hotel to become the hospital. And this is the home care team to visit home when we discharge them back home. Look at the percentage of KCMH or our institution COVID-19 cohort. From our cases, we conclude that 65% of our cases were classified as a mild case. 18% of them have the moderate and they have the pneumonia, and severe case about 11, and 6% of them need to be intubated. The outbreak in our institution is followed the outbreak of the national outbreak. You probably see that the peak of the first outbreak is around March and April, and the second outbreak is between December, January 2021. This is the data comparing between the first and the second outbreak. We have 10,000 patients come to the EAD center for the first outbreak, and nearly 6,000 come to the EAD center. We did the swab test about 3,500 for the first outbreak and 4.6 thousand during the second outbreak. For the positive COVID-19 test, it's 5.3% for the first outbreak and 2.3% at the second outbreak. The severe case is about 10% and 11%, and we need intubation about 6 to 8% in the first and the second outbreak. And we just have one case, the report of death case during the second outbreak. We also have performed the COVID grand round. During the first episode, we didn't know, we have no experience how to take care with the patient with the COVID-19. And the hospital outside Bangkok, far away from the Bangkok, if they face the problem with the COVID-19, they don't know how to cope with the patient. That's why we set up the COVID-19 grand round to share the experience between doctor and health personnel. We also educate the people about the COVID-19 by using the TV broadcast, Facebook or website or flyer to allow the people know about the COVID-19 and how to prevent themselves. COVID-19 is seems to be one of the categorized and change the risk to become the great opportunity. And I think everyone know about the new normal should be happened after the COVID-19. As the medical school, we need to integrate the main mission in this COVID-19 learning experience. This is including the clinical care services, education, research, and innovation. As I mentioned at the first months of COVID-19 outbreak, we didn't know about the natural history of these diseases. We don't know how to take care of the patient. We don't know how to avoid the transmission to healthcare workers, students, and trainees. Until we know that this disease is transmitted quite easily, that's why we need to keep distancing, and we allow the student to study from home. And also our lecturer need to teach at home as well. And we integrate the research in this opportunity. A lot of research questions come to our lecturer, how to treat and how to prevent the disease. A lot of innovation has been invented during outbreak of pandemic. Research funding from government, from the private section come to our institution. And lastly, we also developed the COVID vaccine. What should we adapt during the pandemic era? We need to work from home. We need to use more online training. We need to use a virtual student exchange and virtual visiting professor. We need to live with the technology. AI is seem to be mandatory for healthcare services and also IT literacy. For the online learning, after country was locked down, all school and university closed. So we need to find the appropriate way to continue our education. Our university set up the policy to set up the classroom learning by using online plus on-site learning and have to set up the workplace-based learning. This is an example of the education during the COVID-19. For the medical student, the first year to fifth year medical student, they need to study from home by using online platform. The sixth year medical student, which we call extern, they need to come to work in the hospital with intensive precaution, and some simulation needs to be replaced at the real person. Workplace-based learning. This is a guideline for the critical procedure for our medical students. For example, if our medical student taking care of PUI case, they would not allow to do any procedure in these PUI cases. This is also the chatbot, as I mentioned. This show you the entrance coming to our main building. We have the temperature checking, hand washing, screening with some questionnaire, and then continue cleaning the elevator and every 1 and 2 hours. How about the benefits of online training? We can learn anywhere and anytime, and be no need to be classroom. And this can save the cost of travel and transportation. We can avoid the crowded and minimize the risk of contagious diseases. However, there has something that we need to concern. The first thing about the technophobia, especially the elderly people that are not familiar with the IT. But after for a while, the senior lecturer can use technology very well. And online learning, we have a lack of in-person interaction. Some students have no laptop or Wi-Fi at home. And the most important thing of the online training is about the student assessment. The healthcare system needs to be reformed as well. How about the effect of the pandemic viral infection? Maybe the direct effect of the virus itself, and also the effect on the normal healthcare activities. The patient avoid coming to the contagious hospital, and the resource, some resource need to be diverted to other hospital, and we need to delay all academic activities, academic meetings. What will happen in healthcare system after COVID-19? I think that instead going to the hospital, some people might go to the small clinic in town because they don't want to go to the big hospital and get easy to get the transmission of the diseases. That's why we need to improve the quality of community healthcare in the small cities. We need to do the zoning in the hospital because ordinary care services need to be sustained. We need to convert the regular bed to intensive care beds. And also ambulatory care and daycare surgery is mandatory. Telemedicine is very important in healthcare system in the future. We need to speed up digitalization, including electronic medical record. In our institution nowadays, 100% of our patient department use EMR. And digital prescription, IT infrastructure, AI and big data is also important, and online medical services. This is studied by Bain and Company. They look at the Chinese people that expect to use the digital services in the next 5 years. You probably see that the higher percentage I think up to about once, nearly 200%. They expect to use the telemedicine after COVID-19, and also a high percentage of long-term illness management, digital record, and everything. So the digital services seem to be very important for our life. At Yula, or in my institution, we also use the application which we call July Care. You can load in your mobile and you can make appointment, queuing, paying the bill, and donation and marketing in this application. Other supporting facilities need to be developed to avoid crowded hospital, including the home delivery. We just started to send the medicine from hospital to home by home delivery. And we think about the home care services. We need to get the, let's say, the blood test, do the blood test, the home care, and then just bring the blood to analyze in the main hospital, and the online satellite retail pharmacies. For the research project on COVID-19, we have a lot of grants from government and university and private to study about the COVID-19. We have done some survey study about the awareness and preparedness of the hospital staff against the COVID-19. We have a lot of cohort COVID-19, including the characteristic of the disease, the treatment, the outcome, and also we have the biobank for the COVID-19. And we foresee that for next, for future, we need to do the research for the COVID-19 as well. This is the example of innovation developed during the COVID-19. For example, the robot here developed by the Faculty of Engineering, we call Pinto robot. It's the robot that can communicate between the healthcare, the doctor, nursing, and also the patient who had been isolated in the room. And we also have the swab cabinet for the swab test. And lastly, we also developed the July COVID-19. Actually, it's the COVID-19 vaccine. It's a vaccine we developed with the University of Pennsylvania. And this is a Professor Kiet, who is the pioneer to running the research of the COVID vaccine. It's an mRNA vaccine. And hopefully by end of April or the beginning of May, we can to do the first one in human. The COVID-19 has changed the whole world and it's a long way to go. And we can set up the new normal for medical education and healthcare services. And thank you. I think that the COVID vaccine is hopeful. Thank you.
Thank you very much, Dr. Suttipong. I'm waiting for my video to turn on. I will probably need help with the IT from the IT team. So Dr. Suttipong, it seems like a lot has been done already from the national and also for the local, especially at the King Chulalongkorn Memorial Hospital. So we got several questions right here about national and also from the hospital part. So first question is Chulalongkorn doing any studies on the long-term effects of COVID-19? And I know you just went
Right. I think it's ongoing research to look at the long term of the COVID-19, but we haven't got the result yet. But I'm sure that some of the group of the COVID-19 people, they continue, collecting the data and follow up these patients.
Thank you. The next question is, are mental health services provided for COVID-19 patients?
Right. Actually, we have the group of the psychiatrists and the group to taking care of the mental problem during the COVID-19. You probably see that the percentage of the people who get attempt suicide is maybe not the direct effect of the COVID-19, but maybe indirect effect due to the economic crisis. This may be the one point that make the people think about the attempt suicide. the higher percentage of people is going to be high during that period. And we have the group of psychiatrists to take care of this, but not in our hospital, is in other hospital outside Bangkok.
I see. Well, because I understand that the country is on semi-lockdown, right? And economic impact is brutal, and also tourism. So, and Thailand depends a lot on tourists. And with
Yes.
in lockdown, it has hurt economy bad time. So right now, what about the current availability of COVID vaccines in Thailand?
Right. We start using the COVID vaccine about a month ago, and we have the two brands of COVID-19 import from other countries. The first brand is come from China. You probably know about the Sinovac. And the second brand is AstraZeneca. We just start using the Sinovac about a month ago, and AstraZeneca about maybe 2 weeks. And at the moment, we have about nearly 200,000 people get the vaccination for the first shot. I mean, for the first shot.
Well, that's great. That means the country was already able to control the COVID situation very well before the vaccine rolled out.
Correct. Yep.
So another question is, what are some of the common misconceptions to vaccine that cause hesitancy in Thailand?
Right. I think if you look at the survey, I haven't shown my slide presentation here, but the Ministry of Public Health, they did the survey as well. At the beginning of outbreak, I think, let's say 90% of people want to get a vaccination, and then we can control the outbreak. The percentage of people need a vaccine less than maybe 70%. Even the healthcare worker, I think some center they did a survey, and we found that healthcare personnel, they want to get the vaccine about 70 to 80%. I think they some have misconcept, especially for the mRNA vaccine. They're afraid that the mRNA will change their genetic background or something like that, and they quite concerned about the long-term effect of the vaccine.
So, and now talking about vaccine situations, we now understand that there are new variants, right? Have there been any reports of new COVID variants in Thailand, whether it's UK strain or whether it's the South African strain?
Right. We have the UK strain coming to our country, but I mean, unfortunately, we have the state quarantine, as I mentioned previously in my slide. So every people from other country who have the high risk to develop the UK strain coming to the state quarantine, we get screening and we confirm that they have the variant strain, and we have to do the quarantine them for nearly 3 weeks to make sure that they don't have any virus stay in their body, and that's why we can control. Nowadays, I think we have about more than 10 the UK strain coming to our country.
Now you mentioned the state quarantine. Can you clarify what it means by state quarantine? Is it for foreigners only or for everyone who comes into Thailand?
Right. Everyone who come to Thailand, even the Thai people who study abroad and they want to come back to our country, or the foreigner, they want to visit or do some work in Thailand, they need to get the state quarantine. That means the government afford this quarantine for 14 days. They find out the hotel is not the luxury hotel, I mean, just the ordinary hotel, and with the meal serving and do the screening at the first few days after they arrive. And we do the screen again about 10 days after they get into the quarantine area to make sure that they didn't have any diseases before allowing them to get into our.
So this is Thai government sponsored.
Correct.
Right.
Yeah. The Thai spot. We call this one is a quarantine, but we have another term is an alternative state quarantine. That means if you want to get the luxury hotel, better care, you can pay on your pocket about the alternative state quarantine.
Oh, okay. So like an upgrade, pretty much. The next question is about contact tracing. So how did Chulalongkorn coordinate contact tracing with the Thai Department of Public Health?
You mean the contact tracing? Yeah, you know that if we have a positive case, we're going to trace back to the people, the family, friends, and we call the timeline. We're going to trace back to who is the high risk to get easy to get the transmission of the diseases. And if they have the high risk group, we just bring them to do the quarantine for 14 days as well.
So far, how successful it has been for
Yes.
the tracing?
Yeah, I think it's very successful. I would say that Thai people, they're afraid about the disease. That's why they follow the regulation. I would say not 100%, but most of them follow the regulations.
I mean, it seems to be the case, right?
Yeah.
Because the contact tracing is very clear and very obvious and almost transparent to everyone.
Yep.
So another question from the audience, do we have in Thailand any pregnant women that tested positive for COVID-19?
Right. I think we have some reported of positive pregnant. And I think, I'm not sure, but not in our hospital, we have the baby who have the positive, the COVID-19. But they didn't, I mean, he or she, I'm not sure, have no serious conditions.
That's great. And you mentioned that for both waves, there were around 10 to 11%, right, of COVID-19 infected patients who had severe diseases, and around 6 to 8% had to be evacuated. What were the risk factors? Are they similar to what is described in the US and Europe?
Right. I think similar to other countries, most of them have the risk factor. For example, old age, okay, elderly more than 60, and they have some chronic disease such as the diabetes, chronic renal failure, and some people they have the HIV positive. So this is a high risk group, and they tend to become the severe cases and need intubation.
So in European and in the US, these countries, they see a lot of outbreak in nursing homes, in the elderly population. Is it a problem in Thailand?
Yeah, we didn't have that problem in our country. It's maybe that if we have the positive case, we have to take care of the elderly people. During the lockdown period, we not allow the cousin or relative come to visit the elderly people. So we haven't seen any outbreak in the, nursing care or elderly people.
That is amazing. One comment from the audience is, how do you keep the number of cases so low, especially during the second outbreak?
Right. Even the number is low, but you see the pattern of the second outbreak is not similar to the first one. It's up and down, up and down. And the policy that we did is about the seal the red zone area, and we get active case finding. I don't know, but anyway, I think we be sure that we do the best screening for the people who are suspicious to have the COVID-19. For the second episode, we use the pool saliva and pool PCR to detect the case as well. And even in the market, if we have the index case, we just get into the market and survey the high risk group in that area. But the number is still low because the patient wearing the mask keep physical distancing and have the very good hand hygiene. I think so. I think masking is very important to prevent the diseases.
Yeah, this is very impressive because percentages of the mask wearing actually is 85%. And I understand that in Asian countries, including Thailand, people were wearing masks even before the outbreak. So it is not unusual for them to wear mask during the pandemic.
Mhm.
So there are questions about the high-risk population. So in Thailand, how does COVID-19 pandemic affect those patients, especially those with solid organ transplantation?
I think we have the one case who have the organ transplantation, but
Mhm.
I'm not sure about other hospital. But I think it's a high risk to develop the COVID because you know that these people have the chronic diseases and it's on some medication. I'm sure that this kind of patient is very easy to get the COVID-19. But we haven't seen any big report about the COVID-19 in people with organ transplantation.
Mhm. As far as the COVID testing, is it now available widely anywhere, and is it covered, or the patient has to pay? I doubt
Right.
that. Right, for
uh, the yeah, we have every province have the one center to test the COVID by RT-PCR, and the government pay them if they have the high risk. I mean, if you have the history of the contact in the case, or you have the symptoms of the ARI, URI, and suspect that you have the COVID-19, the government will pay. But if you are healthy and you want to check you have the COVID-19 or not, you have to pay on your own, and you normally come to the private hospital.
Oh, okay. And what about those? I'm intrigued by the concept of the hospital, right?
Uh-huh.
Like after the step down, the patient is discharged, but not completely discharged back to the community.
Mhm, mhm.
So as far as hospital, is this program arranged by King Chulalongkorn Memorial Hospital, or this is arranged by government? And is there any expense to the patients?
Right. I think the first hospital is developed by our King Chulalongkorn Memorial Hospital, and it seems to be role model for other hospital use the same system. Some hospital they use the dorm of the student to become the isolation unit, and some hospital they hire the small hotel to become the isolation unit as well. And for the people from our King Chulalongkorn Memorial Hospital, we pay for the isolation unit or we pay for the hospital, including the meal. Yeah.
And
Mm.
talking about mainly tertiary care hospitals, correct?
Uh-huh.
Not the
Mm.
private hospital. Okay, so next I'm going to shift gear a little bit to the medical education. So with this ongoing COVID-19 pandemic, how are other medical schools in Thailand, especially those who do not locate in Bangkok, modify their medical education and or curriculum? Is it about the same with Chulalongkorn University? Or are you aware that they have some other methods of education and learning?
Yeah. Actually, we have the committee of the medical school. We have the meeting every 2 months, and we discuss about how we manage with the medical students. I think we have the same guideline. That means we allow the student to study from home. Even the medical school outside Bangkok, they also need to study from home, and also we need to use other simulation in the place of the real person. And except, as I mentioned, the 6th-year medical student and clinical student, they need to come to work under precaution and under supervision by the medical staff.
So right now, with the, we are at the tail end, hopefully, of the second wave. Is life pretty much back to normal for staff, for students, and general population?
Right. I think for the second wave, I think the people get used to, and I think they feel quite easily, and they can stay with the COVID-19. I think so by wearing the mask, and they come to work as normal, except that the big classroom. We try to avoid the big classroom or big meeting. Let's say more than 100 people stay in the same room. We try to avoid that. And some activity that we need to get a close contact, we try to ban that meeting, ban that activities. But for the rest, the rest, we look like come back to the normal life. But you need to wear the mask and wash alcohol gel hand rub.
It's still not mandatory, correct? For the mask wearing, it's encouraged, or it is
Encourage, not mandatory.
Mhm, mhm. So now we're on the students topic right here. Have medical students at Chulalongkorn been involved in public health education and vaccine campaigns? And I understand that you said they involved in the bot, right? And the ad. Yes. What is in public health education?
I think let me think. I think the medical students, they help the lecturer to manage with the patient, with the chatbot. For the medical education, I I think they have the committee to discuss about how to set up the classroom meeting, how they set up the examination room during the COVID-19, because I think the medical student have to get involved for the committee to develop the curriculum during the COVID-19.
Right. I think this is a great concept. However, we have to make sure the service does not compromise the education, right? And also for their safety as well. There's several more questions right here that people are firing. So one question is about back to the vaccine. Okay. Chulalongkorn University has been a pioneer in introducing medical technology to the country. Recently, in the news, it says that scientists are racing to develop homemade COVID-19 vaccine.
Right.
Especially during the second wave of the infections. What's the status, and have they started human trials?
Right. At Chulalongkorn, we developed the Chula COVID vaccine. It's a mRNA-based vaccine as similar to Pfizer or Moderna. And for the wild type, that means for the wild type, the first phase of the vaccine, we plan to try in human by end of April or beginning of May, right? But meanwhile, you know that we have a lot of variant. So the scientists, Professor Kiet and the team, they want to explore more about the variant, and they going to do parallel between the wild type and variant vaccine. And hopefully that if we get the phase 1, phase 2 finished by the quarter 3, and then we foresee that we don't need to do the phase 3 trial. If we don't need to do the phase 3 trial, maybe we can get the farmers factory to make the COVID vaccine locally by end of this year or beginning of next year.
Wow, this is such a great news, right? But right now, with importing of the Sinovac and also the vaccine from AstraZeneca, do you expect that the vaccines will be basically available for most Thai people, or do we still have an urgent need to develop locally the COVID?
Yeah. According to the government, we hope that we can get enough vaccine for the Thai people by end of this year by Sinovac, by AstraZeneca, or by other company as well. For the local vaccine, it looks like the vaccine that we develop in case that you need to get a booster in foreign years, and we get the platform to do other vaccines by using the same technology as a COVID vaccine.
I see. Got it. Another question is related to the vaccine, the AstraZeneca. Has there been any reported of side effects, including thrombosis, with the AstraZeneca vaccine? And I know that some Thai people have received this vaccine already.
Right. We don't have any report of the, embolism or thrombosis of the COVID AstraZeneca vaccine. But we have some side effect. It's not the mild side effect. Fever, headache, let's say malaise or eating less or something like that. But it's not a serious one.
So this is something that you would say typical and expected side effects that we see in other vaccines as well.
Correct, correct.
So this is not alarming, and you would still promote vaccination. Use Seneca, also in Sinovac in Thai people. Next question is back to the mental health. How is Chulalongkorn dealing with mental health issues of the healthcare workers?
Right, I think for the healthcare worker, they have some mental problems in terms of, I know that everyone get worried about the diseases because they don't know about the end of the game, when and how. That's why some people, they are aware about the COVID-19 infection. So we have the consultation from the group of psychiatrists and psychologists. If you have any mental problem or they worried and about the COVID-19, we send them to see the group of psychiatrists or psychologists to taking care of the mental health.
It seems like everything has been well thought of, right, and prepared. So it seems like in Thailand and also at Chulalongkorn, it's been a very successful story so far, that the death rate is still less than 100 countrywide. So now, talking about the hard part, what do you think are the most challenging tasks so far?
Right, I think the challengings during the outbreak, we don't know what's going to be happened at the time, because we learn from other country around Thailand that they have very big pandemic, and they need to get to expand the hospital to cope with the COVID-19. And during the outbreak, we think and we plan in future that we need to expand our service to other area. For example, in the stadium, to just do the simple take care area hospital in the stadium. But fortunately, we haven't got that one. So for the second outbreak, we just calm down and we think that we can manage. We have our facilities in terms of the supply and, let's say, ventilator, the health personnel enough to take care of the patients. The challenge at present, I think about the vaccine. So I think that if we can have enough vaccines, and if we can develop on my own for the vaccine to use this vaccine in our country, so I hope that it might be end of the game.
Right. So now you mentioned the supplies. You mentioned having like a stadium, like a pop-up hospital, right? Thailand has not needed that, so that's great. Are there any issues with the PPEs, especially in provinces outside Bangkok?
Right. Yeah, PPE is one issue that, at the first outbreak, we are afraid that we're going to not enough supply of the PPE because we need to get the import of the PPE. But finally, we get some import from other country, and then we also we have innovation for the PPE as well. But fortunately, we have enough PPE, and we also send our PPE from the center to the hospital. Outside Bangkok, and to especially the hospital nearby the border between Thailand and Myanmar, that we have very high risk of the COVID-19 cases. So we can send PPE to that area as well.
Right. It seems like everything has been thought
of. And one key things about the donation, I think the Thai people, they love to give the donation when the country face the big issue or face the big problem like this. They want to give the donation, the food, the PPE, the mask, the N95. A lot of donation come to our hospital and also other hospital as well.
Wow, this is a truly amazing story, and people come together during the crisis, right? And this is kind of once in a lifetime crisis So far we have learned a lot, I think, globally and nationally. So what were the biggest lessons so far that you have learned leading the hospital and medical school?
Yes, I think the big issue that we have the EID center. As I mentioned, we have EID center established in 2015. But when we face the real situation, it's not enough. We need to expand and we need some more things to complete our taking care of our patient. So what we plan in the future, you think that emerging disease or re-emerging disease is maybe come back, quite often than we thought. So I just thinking that we need to prepare everything in hand in case that we have to face with this wave of emerging or re-emerging disease that I'm sure that they're going to be happen soon, maybe in the next 5 or 10 years, maybe something like this coming again. So need preparedness for that.
Right, and the concept of having the EID, the Emerging Infectious Disease Center, even before this pandemic, that's absolutely brilliant. And we see that as more as proactive, right, not reactive.
Correct.
Unfortunately, this is the end of our session. Yeah, so we've got a lot of questions from attendees, and I'm sure people are now wondering, what other countries can do to mimic Thailand's success. So Dr. Suttipong, I want to thank you for your expertise and also for spending time with us, and understand this is like evening time in Thailand. Yes, I also want to thank USF and the Global Virus Network for hosting this event, and also for the IT team and the attendees. And again, there's some comments right here. Excellent presentation and sharing the insight. So thank you very much, and we'll join again next USF Health International Series. Goodbye.
Bye. Thank you. Bye-bye. Thank you, Dr. Fatima. Thank you.